Hi, Alice.
Hi.
My name is Dr. Matt. How are you doing today?
I'm good.
Okay, perfect. Thanks for coming in. I see that you're in for a head-to-toe assessment. Can you please verify your last name
Smith.
and your date of birth?
7/5/2000.
Okay. Can I have your social security number?
123-456-789.
Perfect. All right, and your insurance is the same as last time? Okay, perfect. So let's go ahead into the medical history. Do you have any allergies?
No.
Are you taking any medications on a daily basis?
No.
Okay, any medical history of back problems?
A little bit. Yes.
How long has it been going?
About 4 years.
Okay. Any kidney problems?
No.
Have you noticed any irregularities?
No.
Any heart problems?
No.
Any heart disease in the family members?
No.
Okay. Were you ever diagnosed with a thyroid disorder?
No.
Do you wear contacts?
No.
When was your last dental checkup?
About 4 months ago.
Any surgeries?
No.
Okay. Looks like I have everything that I need. Just going to sanitize my hands and we'll start with vital signs. Have you noticed any flu-like symptoms in the last 48 hours?
No.
Okay. Any rashes that wouldn't go away?
No.
Are you experiencing any pins and needles in the legs or arms? Any headaches that wouldn't go away with Tylenol or ibuprofen? Just going to place this under your tongue. I'm going to have you hold it for me, please. Perfect. And then this will go on your index finger. It's going to measure your oxygenation. Perfect. Have you relax? Let's go on and check that. An 86.1 Fahrenheit. That's very normal. And we'll measure your blood pressure as well. So go on your upper arm. It's going to give your arm kind of like a squeeze. Do you have any arm restrictions, meaning that you cannot use one arm? Okay. I'm going to put the stethoscope right here in the crevice, right around the elbow. I'm going to have you relax now. Okay, blood pressure is a little bit low, 98 over 59. Do you feel dizzy, lightheaded?
No.
Okay. Let's go ahead and write this down in your file. So oxygenation is 98% on room air, heart rate a little bit elevated, 92. Blood pressure, we said it was 98 over 59. Asymptomatic. And the temperature was 96.1 Fahrenheit. Okay, I'm just going to take this from you. And I'm going to have you relax. I'll listen to your heart and your lungs. Is it okay if I put the stethoscope on your chest? Okay. Go ahead and take a deep breath in for me. And breathe out. And again. And breathe out. Okay. Now I'm going to have you breathe normal. We're just going to listen to your heart. I can hear only S1 and S2, no S3, no S4. Just going to listen under the belly too. Just move it to the left. Very good. Let's go ahead and check for any murmurs. Can you go ahead and take a deep breath and then hold it for 1, 2, 3. Breathe out. Okay. Hold it down one more time. Take a deep breath in and hold it. 1, 2, 3. Breathe out. Okay. Going to make some movements. I'm going to guide you slowly with your head. I want to see if there is any kind of pain or limitation in movement, okay? I'll have you relax. Okay. Let's go ahead and put some gloves on. Okay, we'll try that again. Okay, go ahead and relax. Bring it down. Try to touch your chest with your chin. Okay. Any neck pain with that? Alright, I'm gonna have you put your arms in front of you like this. And I'm gonna try to push them down. Don't let me do that, okay? Okay, a little bit of weakness, so try to hold them steady for me. Okay. I'm gonna try to open them. Good. Okay. Okay. Very good. Alright. Can you go ahead and squeeze my fingers? Okay. That was good. Alright. I'm gonna have you lay down and we're gonna start with a scalp examination. Okay, Alice, I'm just going to start by palpating your TMJ. And slowly I'm gonna have you open your mouth as wide as you can. Okay, one clicking sound on the left side. You can go ahead and slowly close. Let's do that one more time, and when you close it, I'm gonna have you do that slowly as well, okay? One more time. And close. Okay, left side. We're gonna send you for an MRI to check placement. We're checking for any lymph node enlargement. Here we have submental. Preauricular lymph nodes and postauricular. Moving down to the neckline, just going to slowly test here above the collarbone as well. This is perfect position because it allows me to really feel checking for any lumps or bumps on the forehead. And here we have the first set of sinuses right above the eyebrow level. And just slowly going to palpate under the eyes. This is where we have the second set. And usually if you were having some pain or discomfort when pressing down, that would indicate some sort of infection, but it does seem to be normal. Checking the eye level to see if there is anything concerning. Face does look symmetric, but I would like to take some measurements here. And if you don't mind, I'm gonna have you slowly raise your head up a little bit, bring it back down. And we're checking head circumference. We're going to put this down in your file. Okay, go ahead and relax again. Perfect. check your ears. So we're looking for any abnormal discharge, see if there are kinds of infection. Alright, I'm gonna have you turn your head towards the right shoulder. Perfect. And I'm going to slowly elevate the tragus. I am seeing a little bit of redness. Do you use a cotton swab to clean your ears?
Sometimes, yes.
Okay. Try not to go too deep in the ear canal, okay? Alright. Just a little bit of earwax on this side, but it doesn't seem to be inflamed. Okay, let's go ahead and place this down here. I'm gonna have you cover your right eye and keep your eyes open for this test. Okay. Can you go ahead and grasp this with your other hand? Okay, and extend your arm all the way. Perfect. Now, can you read the last row for me?
LTFPH.
Okay, and what color do you see right there? On the left.
Red.
And on the right?
Green.
Okay, go ahead and switch eyes for me. And now try to read the last row, starting with the first letter to the right.
HPFTL.
Okay, very good. And what color do you see on the right?
Green.
And on the left?
Red.
And the red, is that the same intensity as the left eye?
Yes.
Okay. I'm gonna take that. Okay, we're gonna go ahead and do a scalp exam, starting with some general inspection with a hairline. I'm going to run a few tests because I do see here a little bit of swelling. Can you go ahead and tell me if you feel this cold or warm? Okay. What about now?
Warm.
Cold. you tell me if this feels sharp or dull?
Dull.
And now?
Sharp. Sharp.
And does this feel cold?
Yes.
Okay. Perfect. Can you go ahead and tell me how many taps you feel this?
2.
And now?
2.
Okay. Does this feel cold?
Yes. Yes. Yes.
And does this feel sharp all the way?
Yes.
Does this feel cold?
No.
Okay. What about now?
No.
And now?
No.
Okay. I'm going to go ahead and take some measurements. Of this line right here. Okay. It does look like we have enough to grab a sample. Okay, so we're going to send that to the lab. Looking for any signs of folliculitis. Just go ahead and turn your head a little bit more. That's good. Any neck pain with that? Okay, I'll do the same thing on the other side. Go ahead and turn your head to the right. Good. Any neck pain with that? Lastly, what I'm going to do is to just slowly palpate the entire scalp with the tip of my fingers. This will allow me to check for any parts that I did not have a chance to look at. Also, I'm checking for asymmetry. Very good. All right. Now I'm going to move to the lower part of your body. So we're going to check your abdomen. Would it be okay if we unbutton the pants just a little bit so that we can see maybe this part?
Yeah.
Okay.
Should I unbutton or just pull it down?
Whatever is.
Because they're pretty loose.
Okay. I think that should work. Perfect. Now we're going to do an abdominal examination. I'm going to go ahead and lift the shirt a little bit higher so that we can take a look at the ribs too. Okay, that's perfect. Relax. Okay. I'm going to start by listening. That's good. I'm going to percuss. Let me know if you feel any kind of pain. Are you experiencing any abdominal discomfort? No. Okay. Now gently I'm going to palpate. Let me know if you feel any pain. We're looking for any distension, tenderness, rigid abdomen. Something that would indicate maybe internal bleeding or anything swollen. Also checking the normal size of main organs. Okay, now that I did a light palpation, I'm going to do a more deeper one. Let me know if you feel any kind of pain. A little bit of tightness there. Okay. I can't feel the liver, which means it's a normal size under the rib cage. A little bit of rigidity here in the middle. Okay. Checking kidneys, so I'm going to slide my hand a little bit under your back here. Relax. Good. Relax. Okay. All right. And on the same thing on the other side. Relax. Okay. Very good. All right. I'm gonna go ahead and check your back now. So I'll have you turn on your tummy and we'll examine the spine. I'm going to go ahead and open the gown in the back so we can take a look at the spine. Okay, I do see here that you have some circles on your back. It looks like you just recently had cupping therapy, is that correct?
Yes.
Okay. Any pain when I'm pressing down?
No.
Okay. Right now I'm going to measure your whole spine, starting with the cervical. And your shoulders. Okay, that looks normal. You're checking for any nerve damage. Go ahead and say 99 for me.
What is it?
99.
99.
Okay. One more time.
99.
Good. Go ahead and tell me when you don't hear, when you don't feel the vibration anymore.
No. No. No.
Okay. I'm going to test your sensations as well. First, I'm going to touch you with a sharp object. This is what sharp is going to feel like. And the other one is going to be dull. This is what dull is going to feel like. Go ahead and tell me if you feel sharp or dull.
Sharp. 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 Dull. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp.
Okay, good.
Dull. Dull. Sharp. Sharp.
Good.
Sharp. Dull. 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 Sharp. Sharp.
Okay, now go ahead and tell me if this feels cold or warm.
Cold. Cold. Warm. Cold. Cold. Cold.
But I'm going to check the skin as well, see if there's any elevations, something that would cause some sort of concern. And if we do, we're just going to send you to dermatology. checking the level of hydration. Okay. Go ahead and take a deep breath in for me. And exhale. And again, take a deep breath in. And exhale. One more time. Breathe in. Breathe out. Okay. Okay, let's go ahead and check your legs. We're looking at placement here. I am noticing right foot going inward. Okay. I'm going to go ahead and clean in between the toes. There's a little bit of dry skin, and this usually helps to moisturize the skin really well. Okay, that should be enough product there. Okay. We're going to check Babinski reflex. Good. Good. Okay. Pedal pulses are 2+, symmetric. Checking for any pedal edema. Any pain when I'm pressing down? Check for inflammation. So we need to see if there's any sort of asymmetry. Okay, we're looking for scratches. Eczema. see here some discoloration. Do you know how long you've been having this?
About 10 years.
Okay, and has it changed in appearance or has it stayed the same?
Stayed the same.
Okay, that's usually a good indication that there's nothing to be concerned of. Everything is benign. Okay. Everything looks symmetric here. Beetle pulses are normal. What I'm going to have you do is I'll have you sit back on the table and I'm going to check your reflexes. Okay, go ahead and relax your foot for me. Okay. 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 I would say diminish reflexes. Okay, let's try that one more time here. Okay, that's good. So go ahead and relax your arms. Good. Okay, just let it loose. I can take all the weight. Okay. Okay. Relax. Okay, perfect. Okay, Alice. So I'm gonna go ahead and send you to the lab. It's right across the room from here. They're going to do a full panel, so I'm going to give you a call back whenever I have the results. Usually it takes about 48 hours to get them back. And if you don't hear from me by then, you can go ahead and give us a call and we'll definitely answer any of your questions. Do you have any questions for me right now? Okay. So we're gonna go ahead and sign the lab work. Good. And whenever you're ready, I'm gonna have you go to the lab and that's it. Thank you for coming.